Hello, I'm Ryan Tucker, Emergency Ultrasound Fellow at Denver Health. Today we're going to talk about the serratus anterior plane block. I have no disclosures. The serratus anterior block can provide anesthesia for the anterior and lateral hemithorax. The dermatomes T3 through T9 can be affected by this block, as shown here in the diagram. The serratus block targets the intercostal nerves as well as the long thoracic and thoracodorsal nerves, all of which run within the fascial plane where anesthetic is deposited. The serratus anterior plane block can provide great pain control for anterior and lateral rib fractures. In this ultrasound image, we see a 7th rib fracture with an associated hematoma. The serratus anterior plane block can also be used to facilitate chest tube placement in patients who are stable. This patient has both rib fractures and a large pneumothorax on the right, and so the serratus block can help with both tube placement as well as pain control given the rib fractures. To identify the anatomic landmarks for this block, the probe is placed in the mid-axillary line at the level of the 4th or 5th rib. The probe can be placed initially with the probe marker directed towards the head. This position of the probe is similar to the location that you would place a chest tube. This still ultrasound image shows the anatomic landmarks of this block. This hyperechoic line here with shadowing outlines the rib. Deep to this, we see the bright line of the pleural interface. The intercostal muscles are the first layer of muscles superficial to that. The serratus muscle layer is superficial to the intercostal muscles, and finally the latissimus dorsi muscle layer is seen here. The target for the block is depicted in this yellow line here. This is the fascial plane where you can deposit anesthetic to achieve a good block. The ultrasound clip here shows the important anatomy for this block. Again, we see the shadow of the rib here. The pleural interface is deep. It's important to identify the 3 separate muscle layers, the intercostal, serratus, and the latissimus dorsi muscle layers. The target fascial plane is here. Once all of the important anatomy has been identified, you can set up to perform the nerve block procedure. The ideal positioning for this block is for the patient to be placed in the lateral decubitus with the affected side facing up. The probe can be rotated such that the rib is in the long axis, as the probe orientation is shown here in this photograph. This provides a backstop to prevent the needle tip from entering the pleural space. The needle tip is inserted just posterior to the probe and advanced in a posterior to anterior orientation, and the needle shaft is followed using an in-plane technique. In this still image of the serratus anterior block being performed, the needle is outlined in white here. The shadow of the rib is shown, as well as the pleural interface. The needle tip is advanced from posterior to anterior until the tip is placed in the fascial plane just superficial to the serratus muscle. If the needle tip is located in the correct location, injection of anesthetic should result in a splitting of the fascial plane, and the layers should separate. You can see the anechoic anesthetic filling in here. Since the anesthetic needs to spread in all directions within the fascial plane, a large volume of 20 to 30 cc's of anesthetic is needed to achieve a good block with this technique. Thank you very much for your attention and for your interest in performing nerve block procedures that can greatly benefit our patients.